Hi, I'm John Halamka. I serve as president of Mayo Clinic Platform. So I'm a 62-year-old person. And what is my currency? What drives me? The answer is making a difference. And there's so many ways to make a difference in this world, but to me, at 62, leaving something behind by mentoring those who will replace me seems to be my highest goal, and hence the reason I came to the conference today. When you look at some of the tough societal problems we have today, they cannot be solved by any one person or any one domain. It really has to be industry, academia, and government working together. And conferences like this bring us all together for dialogue. That's what leads to breakthroughs. I've been working on AI for the last 40 years. When I started, computers were as powerful as today's toaster. What we have in 2024 to 2025 is nearly infinite computing power and storage. We're starting to get curation of the world's data. We have tools that are good enough. So this is a perfect storm for innovation. And we're going to start giving our doctors, our nurses, our pharmacists, and our social workers something back for the decade they've spent entering data. And that's going to benefit everyone, especially the patients. Probably two limitations that I would raise with AI. Remember, predictive AI is math, not magic. So all it's doing is it's looking at the patterns of the past to help forecast patterns of the future, which means it's only as good as the data you use to train it. And so much of our data is incomplete and biased. So we really need to be careful about how we use these tools to do no harm. On the generative AI side, remember the way generative AI works like large language models. It's not thinking, it's not sentient, it's predicting the next word in a sentence based on potentially millions, billions, or trillions of sentences of the past. And hence, sometimes the answers are good, and sometimes the answers are pure fiction. And we need to keep that in mind. Mayo has 8 major large language model projects. Many of them are in lower risk areas, administrative areas, reduction of burden, for which if there's hallucination, there's really not going to be harm. Do you know at the moment, Mayo has 0 generative AI projects going from technology to patient directly. There is always a human in the loop. So taking a generative AI to reduce human burden, having human review, and then patient engagement works at the moment would not turn these tools directly over to a patient. Well, see, what an extraordinary event that brought together so many luminaries in the industry. I find at such events, the presentations on stage are good, but it's the networking in the breaks before and after that's really impactful. And I have spent a few hours networking, and hopefully people who talked to me gained as much as I gained from them.